Hello there, and welcome to this episode of Happy Birthday Wellness Quiz, day 132. My name is Subiri Obwogo. I'm a medical doctor and specialist in public health medicine. I'm also the host of this podcast. In this episode, we're going to discuss the 10 foods that are rich in potassium, in particular for people with hypertension. The key minerals for people with hypertension are potassium, calcium, sodium, magnesium. You can also add fiber to that list. But this diet is actually a balanced diet for anybody who wants to eat a healthy, balanced diet. So the DASH diet is recommended by many medical organizations, in particular the American Heart Association and others. And it doesn't require any special foods. Instead, it provides daily and weekly goals that should meet several recommendations. One is you need enough fruits and vegetables in your diet. The next thing, you need to consume whole grains as opposed to refined grains such as wheat flour and sugars. You need a fat-free or low dairy, that things like milk, yogurt, or cheese. That's basically to ensure that you're not consuming too much saturated fats, which are bad for your heart. You need healthy proteins such as fish, poultry, beans, nuts, and seeds. And then healthy vegetable oils are rich in polyunsaturated fatty acids such as canola, olive oil, and avoid tropical oils that are high in saturated fats such as, for example, soybean oil, corn oil, and coconut oil. You also want to limit fatty meats because remember they contain a lot of cholesterol, basically saturated fats and cholesterol. And then you need to limit full fat dairy, avoid sugar sweetened beverages, sweets, and of course limit sodium. So this plan translates to these nutritional needs. The first thing is you need a majority of your calories to come from carbohydrates, that's about 55%. And then you want around 20% of your calories to come from protein. And then fats, at least 30% to come from fats. As you can see, the DASH diet is very close to those nutritional needs. And of course, saturated fats should be less than 70% of the total calories. You want cholesterol, that's a cholesterol less than 200 milligrams. As you can see, the DASH diet gives you about 150 milligrams per day. And then sodium is less than 2,300 milligrams. This is equivalent to 1 teaspoon. But talk about teaspoon, not tablespoon. And then, or if you can reduce to 1,500 milligrams of sodium, it's even more effective. It's about half a teaspoon. Potassium, you need about 4,700 milligrams per day, and I'll be showing you how you can get this from fruits and vegetables. And then calcium, about 1,250 milligrams, magnesium 500, and then fiber 30 milligrams. Remember, that is per day. So how do we translate these nutrition needs into proper diet? So the first thing is you want between 8 and 10 servings of fruits and vegetables per day, and I'll be showing you how you can get that. Fruits and vegetables are low in sodium and rich in potassium, and if you consume 8 to 10 servings per day, you'll basically meet the necessary intake requirements of potassium as well as sodium because you don't have a lot of salt in fruits and vegetables. You need about 3 servings of low-fat dairy. This is basically to give you calcium. Remember, a cup of milk is about 300 milligrams. So you need about 4 cups of milk per day, as well as things like yogurt to give you 12,000 milligrams of calcium. I mentioned salt, 1 teaspoon, or if you can, half a teaspoon. You need to lose weight if you're overweight. And then moderate intensity physical activity at least 5 times a day. But if it is intense, you can do it 3 times a day. Now, when we talk about a serving, what are we talking about? one serving of vegetables is about half a cup cooked vegetables or 1 cup when they are raw. Now a cup is about 240 milliliters. That's almost the size we're talking about. A 1 serving of fruits is about half a cup of fruits. So now if you consume, for example, 2 cups of fruit salad, that's equivalent to 4 servings of fruits, which means you've taken almost half of your needs for the day. 1 serving of fruits will give you around 3 to 4 grams of fiber, whereas 1 serving of vegetables will give you 2 to 3 grams of fiber. That means if I consume between 8 and 10 servings of fruits and vegetables per day, I'm basically getting enough fiber as well. And then I mentioned that a cup of milk is 300 milligrams, meaning if I consume 4 cups of milk per day, then I'm getting enough calcium. Yogurt has slightly more calcium, about 400 milligrams per cup. So yogurt can be about 3 cups. But remember, it must be low-fat yogurt, not high-fat yogurt. So a question I get is now, which foods are rich in potassium? Now you have a lot of choices. Things like spinach will give you up to 800 milligrams of sodium. That is 1 cup cooked. Avocado is about 700. Sweet potatoes about 700. The potatoes 600 milligrams. Beans. So you have quite a lot of variety in terms of potassium. Even bananas, medium-sized bananas will give you about 400 milligrams of potassium. Although I understand there's a limit to how many bananas you can eat in a day. So is there any evidence that DASH diet works? Now, this study was undertaken by the National Heart, Lung, and Blood Institute in the US, where they randomized participants into 3 groups. One was typical American diet, typical African American diet with fruits and vegetables, and then the DASH diet. And then there was a reduction in systolic blood pressure of 5.5 millimeters, and then 3 millimeters diastolic in group 2 as well as group 3. Remember, 60% of the participants in this study were actually African Americans who are thought to be more affected by high blood pressure. So this podcast was brought to you by Kike Afya. My name is Birthtday Obogo. I'm a medical doctor and specialist in public health medicine. We rely on well-wishers to bring you this content, and you can support us by subscribing to my YouTube channel, liking, or sharing. For those who want to support us in other ways, we have an M-Pesa till number 766500 or M-Pesa mobile number 0720 95 8250. Now see you tomorrow, same place, same time.